Council. This morning we have three proclamations, and the first is recognizing National Multiple Sclerosis Week by Council Member Albornoz and County Executive Elrich. Council Vice President.
Thank you, Mr. President. And actually, my understanding is our county executive will be making the initial comments today regarding this important proclamation, and I will join right after he makes those comments. Mr. County Executive. I think you're on mute.
Thank you for inviting me over today for this proclamation. We know this is important. I think a lot of us have known people who have MS. MS is an incurable, progressive, and debilitating disease, and luckily it can be effectively treated, often delaying progression and keeping affected individuals in the workforce and productive members of our community. It is crucial that a diagnosis of with medications currently available to forestall progressive disability. Unfortunately, treatment is commonly delayed for an average of 2 years after the onset of symptoms, which in turn delays treatment. The delayed treatment results in a lost opportunity to preserve neurological function. And that's why we as the county and our health promotion efforts want to increase awareness of MS as the first and most critical step in preventing or slowing the onset of disability. And I want to thank Dr. Morgan for his work to promote early diagnosis and treatment of this disease. If you get diagnosed early, it can really make a long-term difference in the quality of life, and it's really important that people do this. So thank you.
Thank you, Mr. County Executive, and thank you to your HHS team for your leadership on this and so many other issues. MS is, of course, an extraordinarily challenging disease for more than 2 million people around the world, including thousands here in Montgomery County. And as you mentioned, early detection is so critically important. And although research has really improved and treatment has improved significantly as well, we know we have a long way to go, both in terms of education and holistic support for people suffering from MS. And I am so proud that our Commission for the People with Disabilities has been led so ably by Dr. Seth Morgan now for several years, who, in addition to suffering from MS, has also had some extraordinary challenges with his own health. Dr. Morgan, you look terrific. It is wonderful to see you, and we can't thank you enough for your leadership. Joining us also this morning are Kathy Kohler, Kathy Schemker, and Hillary Kaplan, who are all advocates and strong supporters of ensuring that our county provides all the resources that it can to support our residents who suffer from MS. Dr. Morgan, I'd like to turn it over to you to say a few words, and then the county executive and I will read this proclamation. Dr. Morgan.
Thank you very much, Council Member Albornoz, and thank you very much to the entire council for this proclamation and to Mr. Elrich for this proclamation. This is probably the most important week in terms of MS from my viewpoint the entire year. The reason being all the issues that you all have already raised, that there still is a delay in diagnosis of an average of 2 years after the onset of symptoms. And when I was first in medical practice as a neurologist, that didn't really matter very much because there wasn't much we could do. At this juncture, we have 22 different drugs available that in and of themselves do not cure the disease. We don't have a cure yet, but they all have the potential to forestall worsening and keeping all of us more active and more involved in our community. So it is so important that people consider MS, especially in a disease in which the doctors are having trouble figuring out what's going on. It often is an enigma to them as well, and it's a fair question to ask, could this be MS? Because the sooner it gets diagnosed, the sooner you get treated, and the sooner you have a chance of preserving function. And I greatly appreciate the efforts of you all to make awareness more of an issue for all of us here in the county. As you say, there are thousands of people in just this county with MS. There's 1 million approximately across the United States alone. And probably the worldwide estimates are underestimated, because if you have 1 million already in the United States, it's probably much more around the world. But thank you all very much for this proclamation.
Thank you, Dr. Morgan. We're also joined this morning by Shannon Wood from the Maryland National MS Society. Thank you, Ms. Wood, for you and your leadership and that of your organization. All right, Mr. County Executive, we're going to read this proclamation now. I want to make sure you have it up.
I don't see it. Let me see if I can get it to open. It was not opening earlier.
No problem.
It's very frustrating when things don't open. Okay. You guys must have locked it before. Okay, I've got it. No, I thought I had it. Hold on. There it is. Whereas multiple sclerosis is a neurological disease of the central nervous system affecting nearly 1 million people in the United States, and is a disease affecting residents and their loved ones in Montgomery County and the National Multiple Sclerosis Society Greater DC Maryland chapter provides educational and assistive support to our residents. And
whereas multiple sclerosis generally strikes people in the prime of their lives between ages 20 through 50, with the cause of this often debilitating and erratically progressive disease remaining unknown with no cure currently available. And
whereas for more than 75 years, the National Multiple Sclerosis Society has been committed to a world free of MS, heightening public knowledge of the disease and being a driving force of MS research.
And whereas the National MS Society has invested more than $1 billion in groundbreaking research in its relentless pursuit of treatments and a cure in order to stop MS in its tracks, and the mission of the society is one that all Americans and residents of Montgomery County should support. And
whereas Montgomery County, Maryland recognizes the importance of raising the awareness of MS to ensure timely diagnosis and treatment while striving to find the cause of and cure for the disease, and expresses its appreciation for the dedication to this goal that the National Multiple Sclerosis Society Greater DC Maryland chapter has shown, striving to create a world free of MS. And
now, therefore, do we, Mark Elrich as County Executive, Tom Hucker as Council President, myself as Council Vice President, and Nancy Navarro, who couldn't join us this morning, as hereby proclaim March 7th through 13th, 2021 as Multiple Sclerosis Awareness Week. In Montgomery County, we encourage everyone to learn more about multiple sclerosis and what they can do to support individuals with MS and their families. Thank you so much for your advocacy, for your leadership, and we look forward to partnering with you again in the future. Take care.
Thank you very much.
Thank you all so much. Thanks to everybody. Next, we are coming together to recognize March as Colorectal Cancer Awareness Month and to recognize March 5th as Dress in Blue Day 2021. We are joined by Lisa Rule-Peterson and Kwane Drabo with the Colorectal Cancer Alliance. These are just two of our residents who have been directly impacted by this terrible disease. Lisa joins us today to remember her mother, Janet Rule, and her mother-in-law, Marianne Scruggs, who were both lost to colorectal cancer, and all those that have been lost to this devastating disease. Colorectal cancer is the second leading cause of cancer-related deaths for men and women combined in the United States, but chances of survival are 90% when it's caught at its earliest stage by timely screening. So that makes it a highly preventable form of cancer and underscores the importance of awareness and early detection. You can help save a life this month by joining the Montgomery County government in sharing a message about colorectal cancer. Let me recognize County Executive Mark Elrich for his remarks.
So again, thank you this morning. This is another really important health issue, and I'm really happy that we are doing this proclamation today. As Tom said, colon and rectum cancer together known as colorectal cancer, are the second leading cause of cancer deaths in men and women. But early detection is possible, and it often begins with the screening and detection of non-cancerous polyps. These often have no symptoms, but can be detected by a screening. For this reason, doctors recommend screening for those at high risk or over the age of 50. Most colorectal cancers start as a growth on the inner lining of the colon or rectum. These growths are usually called polyps, and some types of polyps can change into cancer over time, usually many years. But not all polyps become cancer. The chance of a polyp turning into cancer depends on the type of polyp it is. So it's really important to be aware of the symptoms, changes in bowel habits, change in stool consistency, blood in the stools, and abdominal discomfort. The risk factors, age 50 and older, Black people have the highest rate of sporadic or non-hereditary colorectal cancer. Nutrition, current research links eating more red meat and processed meat to a higher rate of disease. Physical inactivity and obesity, smoking, and family history. So the symptoms are, known. We know what the risk factors are, and we know that testing makes a difference. Again, this is another one of those cases where if you get tested early, if you get screened, doctor and follow their advice and make sure you get your screenings.
Absolutely. Get your screenings, everyone. Okay, Mr. County Exec, do you have the proclamation?
I do.
You want to begin?
Yes. Whereas Montgomery County celebrates Dress in Blue Day and March as National Colorectal Cancer Awareness Month to bring greater awareness to colorectal cancer, and
whereas colorectal cancer is the second leading cause of cancer-related deaths in the United States for men and women combined, and
whereas overall, the lifetime risk of developing colorectal cancer is about 1 in 23 for men and 1 in 25 for women, and every 10 minutes a life is lost to this disease, and
whereas in 2020 alone, more than 147,000 new cases of colon and rectal cancer will be diagnosed in the United States, and more than 53,000 deaths are expected. And
whereas a life-saving screening test is recommended to individuals over the age of 45 and those with a family history to help combat the disease, and
whereas Montgomery County has joined with the Colorectal Cancer Alliance in an effort to increase screening and save lives in the county and across the country.
And whereas education and increased awareness can help inform the public of methods of prevention and the early detection of colorectal cancer, and
whereas our goal is to march forth to save 100,000 lives through timely screenings, as this cancer has a 90% chance of survival when caught at the earliest stage, and
whereas Dress in Blue Day and National Colorectal Cancer Awareness Month bring greater awareness to disease and the importance of being screened.
Now, therefore, do we, Mark Elrich as County Executive, Tom Hucker as County Council President, hereby proclaim March 6, 2021 to be Dress in Blue Day and March 2021 as National Colorectal Cancer Awareness Month in Montgomery County in honor of Janet Rule and Marianne Scruggs, who lost their lives to colorectal cancer. We encourage all individuals to work together to promote awareness and understanding of colorectal cancer and the need for screening to end the disease in our lifetime. Signed by Mark Elrich, County Executive, and myself. Lisa and Kwani, thank you so much for being here and for all the work of the Alliance.
Thank you.
Okay. Thank you all.
Thank you.
And our third proclamation. Today, we're recognizing a heartbreaking milestone. It's been 1 year since our state first announced the first cases of COVID-19. We pause today to recognize and mourn the 1,381 Montgomery County residents who are among the more than 500,000 Americans who have lost their lives to COVID-19. The day before the inauguration, President Joe Biden stood at the COVID-19 memorial, and he said, "To heal, we must remember." That is what we must do as a community and a nation. We remember every person we have lost to this deadly virus and everything we've lost so that we can heal. We also honor the many more who continue to suffer from the impact of this virus. A year ago, we had no idea how much this pandemic would change our entire lives, but so many in our community have risen to the challenge of COVID-19. Our first line responders rose to the challenge, our county government workers, our parents and teachers, and our students, our businesses, and our health team led by Dr. Gales and Dr. Crowell. They've all risen to the challenges of this virus. Almost every person in our community has had to come together and adapt so that we could protect each other and reduce the spread. As we remember and reflect today, I'm hopeful because I know this will be the year of recovery. Already, we have vaccinated so many of our most vulnerable residents, and we can start to look forward to a time when we can see extended family members and more of our friends again. Over this year of recovery, we'll have a tremendous opportunity to rebuild a Montgomery County that's stronger, healthier, more prosperous, and more equitable than the one we inherited a year ago. That's what gives me hope today as we remember and honor everything we've lost. We've been joined today by so many of our community leaders who have shown extraordinary leadership and service during this crisis. So let me read their names, and I want you all to know how grateful the County Council is for your leadership and your partnership in this very, very difficult year. We've been joined by Mayor Judd Ashman, Mayor John Compton, Mayor Bridget Newton, Mayor Kate Stewart, as well as Lynn Arndt, Heather Bruskin, Dr. Usa Bunag, Ann Durst, Jackie DiCarlo, Mike Greenberg, Byron Johns, Maisie Lynch, Mayor Modi, Brian Naves, Grace Rivera-Oven, John Ross, Kimberly Rusnak, Reverend Kendra Smith, Venkat Subramanian, and Sandy Zimmett. Thank you all for everything you've done for us and for our community this year. We're very grateful for your leadership and your continued partnership. Let me call on the county executive.
This has been a long, hard year. And, I know how much work everybody here has done. And I just think back to the scrambling around at the very beginning of this and how little we knew when we got hit by this and how ill prepared this whole country was for dealing with it. And it's been a long journey. And I think, it's good to be where we're sitting today. We know that there are vaccines coming. We also know we're not completely out of the woods. We all have to be, I think, super vigilant about where this goes over the next month or so. I know that the health folks are very concerned about strains and what their effects might be. We can't be overconfident. We continue to ask people to take all the precautions we've been asking them to take for the last year. A year is a long time, but when you can finally see the possibility of moving out of this COVID world, I think it's worth it for people to take a little bit more time and be a little bit more patient about how we go forward over the last, hopefully, few months of having to deal with the shortages in vaccine that we've been dealing with. Things will get better. Production is on the way. I know in the county, that without our partners, we would have really struggled to deliver the services and keep programs running at the level that we really needed to. I mean, the nonprofits, the local jurisdictions that all stepped up, that all partnered with us in making sure that people got the messaging that when testing was available, that they made sure the residents got tested. Without the help of everybody on the screen and probably the thousands more people who, aren't here today, without all their help, it would have been a real struggle for us to do it as the government by itself. So I just want to thank everybody, the council for the work you've done, the nonprofits, and all of you here today, the other government officials. We're not out of it, but, if you look at our numbers, we've done a pretty good job of keeping Montgomery County safer than a lot of other places, and that would not have happened but for you. And I always remind our residents, I go out, I don't go anyplace where I don't see masks. I haven't been in the store without seen a person without a mask in months and months and months. And just generally walking around, it's no longer an option. Without people doing this, we wouldn't be here. So I want to thank all the residents of the county for, following the health advice and doing what you can do to make sure that everybody stays safe. So thank you.
Thank you. I mentioned Dr. Kroll and Dr. Gales, but let me thank you as well, Mr. County Executive, for all your leadership this year. I should mention Dr. Stoudert as well, and all of your staff who have been tremendous partners to work with through this very difficult and challenging year. Let me call on Council Vice President Gabe Albornoz.
Thank you, Mr. President. This has been an extraordinarily difficult, challenging, and disorienting year for so many of our residents. In addition to the almost 1,400 residents that have lost their lives, most of our public school students have been out of school for an entire year. We've had businesses that have had to let thousands of their employees go, and some of those businesses have failed. And it has been immensely challenging economically, socially, and from a public health standpoint, disproportionately for too many of our residents. Despite those unbelievable challenges, it's the people in this Zoom right now and the thousands of other county residents that have stepped forward to help their neighbors in need that give me tremendous hope that this upcoming year will certainly be better than the year we've had, but also lay the infrastructure and foundation for us to build back stronger in so many different ways. Two people that are on this call this morning are Dr. Mike Greenberg and Grace Rivera Oven, who saw needs in their respective communities through the developmental disability community and in the Germantown and northern area of Montgomery County, and stepped forward selflessly, putting their own health and that of their families at risk to be able to step forward in this hour of crisis. They are beautiful examples of people who have stepped forward to address the complex and challenging and growing needs of our residents, as so many have here in Montgomery County. I'm proud of them, and I'm proud of all of you, and I'm proud of this community. We are going to come out of this stronger. We are going to come out of this better, and it has been an honor to serve with all of you on the council through this unprecedented year, and you as well, Mr. County Executive, as well as our incredible team in HHS. I look forward to the future. It will be brighter. Thank you.
Thank you. Councilmember Glass.
I wasn't prepared to speak, but I just want to echo the sentiments of you and Councilmember Albornoz, and just thanking everybody here for all the incredible work that you all have been doing. We are all in this together, as we said at the beginning of this pandemic, and it is held true 1 year later to make sure that all of our residents are healthy and safe. Thank you.
Thank you very much. Okay, I think we have a proclamation in front of us. I'll read the first clause, and then we'll go to Council Vice President Albornoz, and then all the council members in alphabetical order. Whereas COVID-19, an infectious disease caused by a newly discovered coronavirus, was first detected in Montgomery County in March 2020, and on March 5th, the state of Maryland declared a state of emergency, and overnight, our way of life was changed.
And whereas shortly after, our schools quickly pivoted to remote learning, our public safety, frontline workers, and medical staffers had to scramble to find personal protective equipment to serve and treat our community. And our local businesses were forced to close their doors to protect our public health. And?
Councilmember Friedson.
I don't have it in front of me.
Whereas we are grateful to our healthcare heroes, our first responders, and our essential workers who keep showing up and putting their own lives on the line to save others, as well as our nonprofit and community partners who mobilized to serve our community. Councilmember Glass.
And whereas our community and nation have suffered tremendously during this past year, losing more than 525,000 Americans nationwide and more than 1,426 residents to the virus here in Montgomery County.
Councilmember Juanda. And whereas community leaders and organizations have worked relentlessly over the last year to provide critical safety net programs by appropriating necessary funding to keep our residents, restaurants, small businesses, nonprofits, and arts organizations afloat during the pandemic. Councilmember Katz.
And whereas Montgomery County also provided more than $53 million for rental assistance, more than $30 million for food security, and more than $80 million for our small businesses and local restaurants to assist our community during this challenging time. And
whereas we are grateful to each Montgomery County resident for doing their part in slowing the spread by wearing masks, social distancing, avoiding large gatherings, getting tested and vaccinated, and
whereas with safe and effective vaccinations underway to slow and ultimately eliminate the spread of the virus, we appreciate our researchers who developed the vaccines and our vaccinators for fully vaccinating 90,368 county residents and for vaccinating 187,164 residents with their first dose. And
Councilmember Reamer. Whereas these vaccines and the way that our community has pulled together during the pandemic has made it possible to conquer this virus and emerge stronger as a community with a bright future because we are Montgomery County strong and we will continue to get through this together. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland hereby recognizes March 5th, 2021 as Montgomery County's one-year battle against COVID-19, presented on the 9th day of March in the year of 2021. Tom Hucker, Council President, Mark Elrich, County Executive. Thank you all so much for all your leadership.
thank you, guys.
Thank you all.
thank you.
Thank you.
Okay, now we'll have general business. Madam Clerk, do we have any announcements, agenda changes, or petitions?
Good morning, Mr. President. There are no announcements this morning.
Terrific.
Pardon me, Council President. We have a video to present for
Oh, I
Proclamation
beg your
C.
pardon. I beg your pardon. We are not done with the presentation yet. We have a video message from Montgomery County's own local hero, Dr. Anthony Fauci, to Montgomery County and its residents. Please go ahead.
Warm greetings to you all. My name is Tony Fauci, Director of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health in Bethesda, and Chief Medical Advisor for COVID-19 to President Joe Biden. I am delighted to have this opportunity to congratulate and thank the County Council and community leaders of Montgomery County who have worked so hard in responding to the COVID-19 pandemic on behalf of people who live and work in the county. With the recent emergency use authorization of a third COVID-19 vaccine by the Food and Drug Administration, we are well positioned to bring this historic pandemic under control if we all just hang on a bit longer. Now is the time to keep our foot on the accelerator with regard to adherence to public health measures such as masking, physical distancing, and other measures that we know work to protect people from the SARS-CoV-2 virus, while we are ramping up efforts to vaccinate as many people as we can as quickly as possible. Using both strategies in tandem is the most effective way to quickly reduce the level of virus in the county and thwart new infections. We are all in this together, and working together is how we can end it. Thank you for supporting NIH. Stay well and keep up your outstanding work.
Fantastic. Thanks to our staff and Chief of Staff Dave Kuhns for pulling that together. I don't know how I forgot. Okay, we can move back to the agenda. The clerk has distributed the minutes to council members for the meeting of January 26th, 2021. Are there any changes? Hearing none, those are approved. So now the council will sit as the Board of Health and will receive a briefing on the coronavirus and our public health planning. Dr. Gales, Dr. Kroll, Dr. Stoddard, welcome. Dr. Gales, do you want to begin again? Take it away.
Good morning. Hard to follow Dr. Fauci on that one, but he said everything that I would say. I don't think there's much else to say. His comment underscores actually my first bullet point that I wanted to discuss, which is related to how we move forward with our case counts in the setting of plateaued numbers, variant strains, and increasing vaccination coverage. So the first thing I'd like to say before we go over the pulse report with vaccinations is that, yes, our numbers are averaging somewhere now between 90 to 110 cases per day. And that does represent an improvement from where we were late winter and earlier part of this year. We have, again, as we've stated before, continued to look out for the presence of the variant strains within our community. We were on a call with MDH yesterday where it was reported that Maryland is one of 2 states, Florida being the other, where there have been all 3 strains of the variant strains have been detected, including the UK, the South African, and the Brazilian strains. So we continue to monitor that situation and follow the guidelines from the CDC and Dr. Walensky's recommendations on not moving forward too quickly in terms of reopening. And as you just heard from Dr. Fauci himself, as well as the guidance from the NIH and members of the President's COVID-19 task force. Now, we, in the coming days, and potentially as early as today, I think the governor has a press conference today, and I don't know what he will be talking about, but I suspect that it will be about some components of reopening and moving forward in Maryland. And there are other states that are announcing their particular strategies, from Texas to Illinois to other places. I want our folks at home to understand that we are continuing to, again, monitor the situation and provide guidance that is not overly aggressive, that would put us in a position where we could be extremely vulnerable to the presence of variant strains, as well as the potential to see our numbers increase significantly, particularly in a setting now where we have moved forward with our kids returning back to school. And we're looking at other restrictions that we could potentially relax. As we move forward in the short term, those restrictions that probably would get more consideration for relaxation, and I think you all will be discussing it in a potential executive order, is increasing childcare capacity to be consistent with the state levels, and also looking at some small incremental changes to gathering sizes for indoor and outdoor activities. We do recognize that there's lots of folks who will be asking questions and sending in information about their respective venues, their respective types of activities. But I want to be clear, at least from the public health perspective, that is the approach, the guidance that I will be providing to the county executive and to you all as the county council and board of health. I also want to emphasize is that the approach that we're taking to reopening is identical to the approach that we have taken from throughout the pandemic in terms of looking at our numbers, making sure that they are sustained and they're at levels of reasonable community transmission to protect us from moving forward. Now, obviously, some of the things that are different now than before is the presence. We do have a vaccine now. The CDC did release guidelines in terms of how individuals who have been vaccinated can move about within the respective communities. And now that we have that guidance, we will also continue to look at how to factor that in terms of providing guidance around reopening. Now, as much as we celebrate and are excited that we are moving people through the queue to get vaccinated, we still have not vaccinated more than half of the people in our state and in our respective jurisdiction. So we do have a ways to go before we can feel comfortable that we're achieving high enough levels of protection through our community to be able to open up more broadly and more successfully. So I just wanted to emphasize those points. Again, Dr. Fauci was a perfect setup for that to move forward. I would like, if possible, to share my screen to go over our pulse report numbers. Okay. And I'll go through this really quickly. I do want to highlight before we start this is that we did have a successful rollout or beginning of our pilot that we talked about, working with Care for Your Health around creating vaccine opportunities for homebound seniors. I believe, including today, they will have vaccinated over 60 individuals through that process and have, I think, another 20 scheduled. We also are looking to partner with another entity to offer those types of services as well in the beginning for homebound seniors, but certainly as we move forward, individuals who may not be able to access our large vaccination sites. Additionally, last week we also received our first supply of Johnson & Johnson doses. We received approximately 1,600 doses. We did do 2 large clinics on Friday and Saturday where we vaccinated within that space just shy of 1,100 individuals. We provided vaccine. We'll be providing additional vaccines today for individuals within our shelter communities and other opportunities as well. So we fully expect that we will exhaust those doses by the end of tomorrow. Now, as we've reported before, due to capacity restrictions, we will not have additional doses of the Johnson & Johnson vaccine at least for another 2 weeks. We're hopeful that the production will increase and the national supply will allow for distributions to states 2 weeks from now. That's the initial information that we've received from the federal government. So we've already talked a little bit about this. We're moving in the right direction. We still have not achieved levels of community transmission where we were during the summer months, where we reopened more broadly from phase 0 to 1 and phase 1 to 2. When we look at our vaccination numbers, we have had just shy of 18% of our population vaccinated, at least with the first dose, which is above the statewide average. We've achieved over 70% of our 75 and up population, and our 65 to 74 group, we're just shy of 50% within that group. The county apparatus, again, is vaccinating and continuing to vaccinate individuals in 1A, 1B, and tiers 2 and 3 of 1B, including a host of essential frontline staff throughout a host of different industries, as well as individuals who are over the age of 65. And let me just remind folks at home, if you fit these other categories in priority group 1C, including tiers 2 and 3, you are able to get vaccinated at any of the other sites throughout the county, retail pharmacies and hospitals, as well as the mass vaccination sites throughout the state. This is just, again, our number to show the number of doses that we have administered, first doses as well as second doses. And you start to see where we stand in terms of the percentage of population who's been vaccinated. We're continuing to make significant progress in that area and climbing that ladder, if you will, in comparison to other jurisdictions. This schematic shows, again, the number of doses administered versus the number of doses received. I will say the gap between what we have received versus administered is in large part due to second doses that we have available. We believe that we received more doses than we were supposed to receive for second doses, and we are conducting an audit to make sure our numbers match up to the state. But in terms of first doses we received, let me emphasize that I believe we have exhausted, or if we haven't exhausted it, we are down to double digits of first doses left that we fully expect to use up today. And I want to be clear, that's one of the things that we were told by the state that the governor put out, or everyone's being encouraged to use up every dose they have, and so that their dose allocations won't be cut. We've done that. And so we continue to move forward and push across the board, all of the health departments, a request for the health departments to receive more doses to provide to our residents. And these, again, are preliminary numbers for the percentages of distribution. Again, this includes both first and second doses. So that's why the percentage is 92% as opposed to close to 100, which would include those first doses that I just mentioned. Just moving quickly through, we're starting to see some slight improvement in terms of the vaccines administered, the percentage of vaccines administered, comparison to the percentage in population. So again, it's incremental improvement from last week, but you can see we still have a significant way to go, particularly in our Black and Latino communities. When we look at the 65 to 74-year-old group, we again see some area of improvement that we need to match our population levels. We are hopeful that by being able to move forward in this priority group with the county, that we'll be able to address some of these gaps with the efforts that we have in terms of increased outreach and education to particular communities, as well as increasing some focused vaccine opportunities, again, in those high volume zip codes and within those proximate areas. Again, this is just showing the vaccines relative to those who are over the age of 75. Again, we've vaccinated just shy of 75% of the 75 and up group. Pre-registration statistics, we're again encouraging folks to pre-register if you fit those particular criteria and prioritization groups that we just discussed. This is just looking at statistics by occupation. And we're starting to see, as no surprise, an increase in the pre-registration for those who are 18 to 64, anticipating that, at least in the county system, they would be the next group, the 18 to 64-year-olds who have medical conditions, and will be in the next group as we move forward. This just shows disparities in registration comparison to vaccination rates. Again, it just completely confirms, again, what we just discussed several slides ago, that we have room to go in terms of matching up vaccine levels with population levels by race and ethnicity. Overrepresentation, unfortunately, of areas with lower pre-registration numbers matching up with, again, looking at our priority tier 1 zip codes that have a higher percentage and burden of cases related to that. So again, that shows an area that we've got to continue to improve on. Here's where we stand in terms of the groups that we're currently vaccinating. Again, tier 1A, 1B, and all the way down to 1C, tier 1, 65 and up. Again, these are just for the county apparatus. And this shows you just the breakdown by age in the county in terms of percentages of population. So I will stop there and turn the floor over to Dr. Stoddard, but as always, happy to, or Dr. Colo, happy to answer any questions that you all may have. Thank you.
Thank you.
Colo, I was going to let you go.
Sure. Just a couple of brief updates for folks, just to let you know that we are we're in the process of re-updating our equity framework. We've shifted fully into 65 and older and into tiers 2 and 3, won't be tier 2 and 3. And are also, you heard this, Dr. Gales' report on J&J and how we're distributing vaccine for the J&J vaccine. Word is that we'll get more, but I think that it'll be a minute before we get major upticks in doses, I think. The other thing is that we are looking at the frame again. We're continuing to update the frame, so we'll update to see where the case rates and the deaths have taken us in terms of whether or not we need to change or adjust any of our zip codes or targeted hotspots. I don't think it's likely. I don't think it's shifting that quickly. But as we update, and if there are any changes in that, we will let you all know a little later this week. In partnership with Office of Community Partners, Office of Community Partnership, and our community partners on Round Vaccine, they stood up a first mass registration site at Mount Calvary Baptist Church in Rockville with Pastor Moultrie. I wanted to thank him publicly for his work in helping to stand up the site and getting the word out. The team hung 1,000 door hangers on doors to let folks know, here's how you pre-register, here's how you can come in and pre-register, how you can call or how you can walk over or drive through. And the response was not as great as we expected, but it was a good model for how we move forward. And I think the other community partners in the other regions with the regional service centers are looking at ways to do that, as well as standing up regional and culturally appropriate spaces for folks to call in and pre-register so that we can help them to pre-register in this process. And the last thing I will say is that we are getting requests across the board for folks who would like for us to stand up vaccination sites in their churches, in their community centers and such. And at the same time, we're also getting offers for folks who are prepared to vaccinate, who have the capacity to actually do vaccinations. We are working now, my team is working now to develop a process to try to collect that information and centralize the process. Those invitations and offers are coming to you all at council. They're coming to Dr. Gales, to Dr. Bridges, to Dr. Stoddard, to myself, and from all directions. And we need a way to coordinate that and maybe centralize that so we can line up folks who are capable of vaccinating with folks who are asking for sites, asking us to do that. All of that is dose dependent. We're talking about dividing 4,600 doses into a lot of different places, and balancing small delivery systems with capacity to do larger scale vaccinations. And so we're having to do with both of those things at once. So I ask folks a little bit of patience. If you send us something on Monday, we will not be able to respond to that person necessarily by Thursday to say, yeah, we can or we can't. But we will work on putting something together that gets them together and building capacity so that as doses come in, we can, and if the county is fortunate enough to get more doses, we can help. We can draw on some of that support to distribute. And as we have opportunities to move around our vaccination efforts, we'll move around our efforts to our vaccination efforts into the communities where where folks have been hardest hit. So that's my quick update to you all for today. Thank you.
I have just a few updates. First off, our Community Recovery Advisory Group met last night. Our focus was on vaccine communications and addressing hesitancy in our communities. Had a very robust conversation with our community partners from across the county, representing our regional service center areas, as well as many of our boards and committees across the county, and how they can help us support this work. And a lot of good feedback came out of that about how we can better communicate with some of those entities to get the message out further. In addition, last Wednesday, we held a webinar in partnership with the Department of Housing and Community Affairs focused on our landlords and tenants, thinking about our buildings and how we can make those spaces safer as, with ventilation and things like that as the weather gets warmer. As I think I saw 60 degrees on the docket for later today. Obviously, we can begin to open up more doors and windows, increase ventilation in our spaces. We certainly want to encourage our residential buildings and our businesses to do that to the maximum extent possible, because that will make their spaces much safer. The last thing I want to touch on is our continued emphasis with the state around a mass vaccination site in Montgomery County. We had a meeting as early as 8 a.m. this morning with the state to continue to discuss those opportunities. The state is committed to its next two sites, one in Western Maryland, one on the Eastern Shore, before it will commit to additional sites. The state is under the impression that the vaccination quantities from the federal government are not likely to increase before April 1st. And as such, they're reticent to commit to an additional site until they have an increased degree of confidence that there will be an increase in vaccine quantity. However, they are definitely interested in our site proposed at Montgomery College Germantown, so much so that they are going to schedule a walkthrough with the National Guard elements to as a sort of a pre-visit to look at the site logistics and help us with some of our thinking about how we plan around that. We are moving forward with our clinical partnership with Holy Cross Hospital to serve as our, one of our partners in developing that site out. And so we will proceed forward with the planning, but we have not gotten a commitment from the state to necessarily coin it as a mass vaccination site at this point. They haven't said no, but they just haven't said yes either. So we're continuing with our planning efforts. Our goal is to do as many of the logistic things up front as possible to make it as difficult for them to say no once the state has more vaccine available to it in a few weeks. And so I will stop there and we can entertain questions.
Thank you. Dr. Bridgers, welcome to you as well. We're grateful to all of you for your service and your help. Just a couple quick questions. Let me call on my colleagues. One is, many of you know, in our media briefing yesterday with the Council Vice President and Dr. Kroll, we had invited leaders of vaccine hunters that have helped over 1,000 residents secure vaccine appointments. And they brought us several narratives that were pretty consistent about folks that they had been able to get an appointment for at retail pharmacies, encountering what they perceived as racial profiling, being asked for additional forms of ID and other questions that weren't asked of other folks in the line. So can you talk about how the county is ensuring consistency in our community health clinics, and also what efforts do you know about at the state level to inform private providers of who's eligible and what can be asked and what can't be asked?
Sure. So I think the first thing to say is that that type of behavior should not be tolerated and is unacceptable. We should not be putting in practices racial profiling in general is not acceptable, but we shouldn't be putting in practices and barriers to prevent people from or discourage them in any way from being able to access something that is meaningful and life-saving. And so that is just an unacceptable practice. And we, as far as the county apparatus, we don't partake in that. And let me be clear, if there is any concern in any of the county vaccine clinics where that might be happening, to personally let me know, and we'll be happy to address that and move forward. Now, to pivot to what you mentioned in terms of these being retail pharmacy sites. So the other thing I have to be clear about is we as the county do not have any regulatory stance over those clinics and over those entities. That has been one of the concerns that we as health departments have raised repeatedly with the state when it was brought to our attention that more doses would be sent to those entities. Again, let's be clear. We don't decry increasing access and increasing opportunities for vaccine in those places. What we have been asking for is to ensure that there's fair, equitable practices in place in terms of distribution and allocation of those resources, but also in terms of the practices for folks coming in and being able to receive those vaccines. So the particular instance that you referenced that they brought up has been published. I believe it's in Maryland Matters or a number of other venues. We've shared the information with the state, again, to remind them and to ask them what their policies are in terms of providing additional oversight to those places, because I can't speak for the state, but I would hope that that would be alarming behavior for them as well and something that would cause them to take further action.
Thank you. Two more quick questions. One is, now that there are some schools open on a limited basis, have you been briefed on any challenges they're encountering, and how are we monitoring and tracking what's being done to make sure that the opening is safe?
Well, I think the biggest challenge that they're facing, so there's limited data points in terms of, I'm not sure, I don't believe there's been any outbreaks or anything like that in the first week of them going back. But obviously we will continue to monitor that, consistent with the approach we took in the fall with other schools. I think the biggest challenges that schools are going to face is, again, continuing to operate within the public health guidance, particularly around space. So, continuing to, as folks are demanding that they increase capacity in the schools, the capacity is significantly impacted by the requirements to have 6 feet spacing and distancing within those spaces. And so I think that is going to be one that continues to be a challenge as they bring more kids back into the classroom, is how to operate and maximize capacity within those particular requirements that have not changed. And at this point, we're not offering any recommendations to change that. We have a ways to go. So I think, they continue to work and continue to try to be nimble, to be responsive to the needs of the kids, the staff, and parents for their requests and demands, but also respecting the public health guidance that's been put into place.
Thank you. And finally, we never talk about partisan differences in this briefing for obvious reason. The virus affects everyone. But I'm troubled by the recent survey results that say that in multiple polls, around 26% of Republicans, 14% of independents are unwilling to be vaccinated at this point. And I'm wondering if you've had trusted community voices and leaders provide messages to other communities to address hesitancy. And I'm wondering if you've put any thought into asking Congresswoman Morella or WSSC Chair Howie Dennis or others have a message to Republicans and independents saying this is the real deal and everybody needs to get vaccinated.
So I think to say that community partners have not been focused on that at this point. We have been much more focused on education and getting folks who are willing to take vaccine pre-registered and engaged in the conversation. We haven't hit in our efforts right now a point of hesitancy that has made it has resulted in a fall off in people who are willing to get vaccinated. So that's been our priority for the moment. But clearly, as we go forward and start thinking about messaging for hesitancy, we're going to have to expand both our voices and the message to deal with folks who are, for partisan reasons, less interested in vaccination.
Sure, and I don't know whether the governor has a program in this area, but I know it's not probably top of your list, and we have a lot bigger problems. But just wanted to raise that.
We'll keep it on the radar.
Yeah, sure, of course. Council Member Navarro.
Thank you, Mr. President. And I also want to acknowledge, since we have the proclamation, basically memorializing that it's about a year out. Want to thank Dr. Gail Stoddard, Dr. Kroll, and the entire team for everything that you've done to guide us through this incredible year thus far. Dr. Gales, just in order to respond to the public, which everybody is wondering, what does it mean to perhaps reach a point of herd immunity, or as you were describing, obviously we're not there yet, but what will be the metrics so that people know as things begin to get better with the vaccine rollout, as people start hearing these types of directives now from the CDC, et cetera, what will it look like in terms of what you are tracking to get to a point where we can say, all right, I think we're there now. Can you talk a little bit about that? Because I know it is a question that I get asked quite a bit.
Sure, thank you for the question. I can probably give you more insights in terms of the types of things we would look at more so than a specific metric. So the kinds of things that we would be looking at is certainly increasing percentages of those vaccinated in the categories we consider to be most vulnerable. That would include our age-specific categories. That's why we trot out every week, here's a percentage of 75 and up we're getting covered, here's a percentage of 65 and up getting covered. So the higher that percentage, the more comfortable we may feel, because those are the folks who unfortunately are more likely to be hospitalized and more likely to experience a COVID-related fatality. Similar to that, and more non-age specific related, is getting increased protective levels in that 16 to 64-year-old group who has medical conditions. Because again, when we drop the age, those folks who are more likely to have severe complications or COVID-related fatalities are individuals with those coexisting conditions. And so, we've made great progress in terms of getting protective levels or getting closer to protective levels. And when I'm talking protective levels, you hear, things like 75, 80%, those types of numbers. That's what we're looking at. We're looking to, obviously would love to be as close to 100% as possible, but 80 to 85% and higher are the type of levels that you would be looking at to have some, or begin to talk about some level of herd immunity. And so we've got a ways to go, because we've got to get, more vaccines out again to that latter group that I mentioned, that 16 to 64-year-old population with those coexisting conditions, because again, they are the ones who, separate from age, are more likely to have complicated courses and potential fatalities.
It's really important just to understand the terminology. So when we talk about herd immunity, what we're actually talking about, just like when you say the word herd, what it is that individuals within the group are protected by virtue of the status of people around them. And so right now we're focused on individualized protections, which builds towards that point where, if you have a family member who's living in your house and everyone else in the family is vaccinated, there's not much exposure risk to the individual who can't be vaccinated or isn't vaccinated. And so this is obviously true. This will be true for a long time for newborns and those who aren't able to take the vaccine. We're going to be protecting them by virtue of everyone else around them who's exposed to them being protected. And so we are seeing, across the country, a reduction in COVID-19, which is largely driven by reducing the availability of hosts, vectors, by vaccinating them. So there is some protective immunity, but you don't get to herd immunity until we get to that point where we're actually insulating individuals who are not vaccinated by virtue of everyone else who might be a vector for them being vaccinated. So just to understand the terminology.
Thank you.
Go ahead. I was going to say the number that you need to vaccinate is much higher when you have the variants as well, though. That's important to understand. The transmissibility of the variants being higher means that you need a higher threshold of vaccination in order to achieve herd immunity.
I really appreciate that. I think it is important to understand the terminology. Obviously, everybody's following the news very closely, and it can be really confusing, especially when you start thinking about how does that apply to your community. And I think obviously the concern with the variants is one that we need to continue to point out. Also want to acknowledge that it's a small step forward, but I think it's great that the state will come to at least do a site visit. I am all about being proactive, and as the production starts to increase and more vaccines obviously, are available, it would be great for us to be ready for that moment. And I appreciate all involved for getting to this point. I know we've all been saying this time and time again, as publicly as we can. And so it is appreciated that the state has, has decided to at least come and take a look, and hopefully this will be a reality soon. Thank you.
Thank you. Council Vice President Albornoz.
Thank you, Mr. President. I want to go back to your comments, Mr. President, regarding the comments made by vaccine hunters yesterday at our press conference. By the way, as we were speaking, the vaccine hunters were on CNN, and my staff report that they did a fantastic job. So It's great that their incredible leadership is being highlighted on a national level. So as you mentioned, Dr. Kroll, yesterday, and I know we're limited in what we can do here from a regulatory standpoint, because it's ultimately the state that has the most jurisdiction over our pharmacies and the private providers who are disseminating the vaccine. But as you all can attest, this is a very significant issue, because there is already some reluctance among some of our communities, and we're doing everything we can to educate them, both in terms of the efficacy of the vaccine, but more importantly, making the registration process easier and more equitable and easier to access and culturally appropriate. And so if just one or two or even a handful of people have a negative experience trying to access the vaccine through private providers, it does have a very negative cascading effect and make our work as the public health team even harder to get folks to engage. So we are meeting internally within the council to explore all options that we have at our disposal, whether that's sitting as the Board of Health or possibly even legislation, if it makes sense or if it's possible. But I think it would be important for us to set up, to the degree to which we can, an emergency meeting with state officials, including us here at the local level, in addition to our incredible public health team, because this problem is pervasive, not just in Montgomery County. Delegate Benya Melnick has focused on this in our Prince George's County community as well, and I suspect in other communities such as Baltimore and really across the state, this is probably taking place. And there was a response in part from one of our pharmacies in a recent article by Maryland Matters, which indicates that because of federal regulations, they believe they are required to request some level of information if a person does not have insurance. But the manner in which that's conducted, the manner in which it's communicated is really important. And I think that everyone needs to take stock of the initiatives we've had here through Por Nuestra Salud y Bienestar, our African American Health Program, and especially our public health team in HHS, who have taken great pains to make sure that the registration forms, the support is all culturally appropriate. That has to extend to our private sector. It's like really important. And so we're going to be meeting later today internally, but if we could make a pitch or a request and just let us know who the right person is to reach out to see if we can set up a meeting. And I think this should be a cross-jurisdiction meeting, Mr. President, with other colleagues from other areas as well. And it has to be among our highest priorities right now, because it has to be addressed as soon as possible. Because the longer we wait, the bigger the problem becomes in a variety of different ways. So more to come on that. And then my last comment is just sort of a note. You know, there was a lot of social media around. There are going to be positive test cases in our schools. We've all discussed that that's inevitable. But I think this is an instance in which we can look at what has transpired in our private schools and the transition that they made in the fall, to have some lessons learned. As I've indicated before, my wife teaches at an independent school, and they have put together a plan that is consistent with the plan that MCPS has put together, which has been really remarkable. And I give a lot of credit to the HHS team and the contact tracing team who has worked with those schools to address these issues individually. And I know we're going to be doing the same thing within our public schools as well. So I just want to say that publicly to the folks who've been texting or tweeting us regarding concern, understandable concern over incidents in schools. So with that, those are all comments today. Don't have questions at the moment, but I yield back to you, Mr. President. Appreciate you.
Thank you, Council Vice President. Councilmember Katz.
Thank you very much, Mr. President, and thank you. It is hard to believe that it's 1 year. In one respect, it's been a fast year. In one respect, it's been a slow year, but there's been no question it's a horrendous year. And I do appreciate Councilmember Navarro's question about herd immunity. I've heard that from several people as well. I've had some questions with it, but I did appreciate your answer, and I hope that we can get there. As you say, there might not be a magic number, but there does seem to be some magic involved with it. The press is reporting that the larger counties did not, which we knew, did not receive their proportionate per capita doses as compared to some of our friends from the other counties in Maryland. Is there any, in your conversations with the state, are they looking at how they might be able to correct that error?
Thank you, Councilmember Katz, for that question. I think it would, without making any editorial comments, I think one would have to, the definition of error would be.
Well, I'm being diplomatic.
So you're correct. And so the challenge is that, we recognize that all of the jurisdictions need to get doses because everybody needs to be covered. But you're right. When you look at the actual numbers, the larger counties have received a smaller portion related to the per capita numbers. That's something that all of you, the federal delegation, the state delegation, the health department, we've all asked for clarification on that and how that can be improved. And recently, as we've continued to advocate for more doses, in addition to mass vac sites, the question is said, well, you have to use what you have. We are using what we have, and we are putting those numbers out as evidenced by that. So anyone listening at the state level, we are doing that work and we're doing what you asked. And our allocation has not increased over the last month. And let's be clear too, is during that time period, well, I think Dr. Stoddard mentioned that, the state levels will be frozen for some time. Let's be clear, in the last 2 to 3 weeks, the state average in terms of doses they've received has increased significantly from 72,000, which is where they were averaging, to, I believe, in the last week or so, they received more than 100,000 doses. And so what we have been asking from the health department perspective, not just from the large jurisdictions, because certainly we have a ways to go to make up that difference, we're asking how are those doses being allocated and how can those doses be increased to the local level to support the work that we're doing, particularly given that we have been asked to add on other, cover other things such as long-term care facilities not covered by the federal partnership and other independent living facilities for individuals with disabilities.
Thank you. And on the other mass sites, and it is good news that the state is at least now having a good conversation and saying that Montgomery County certainly does need and deserve a mass site. But for the other jurisdictions, Western Maryland and Eastern Shore, are they in the next couple of weeks? When are they in a timeline supposed to get theirs?
I think the states announced the timeline. I mean, it was basically 1 a week for the next 2 weeks, or maybe there's a skip week. But basically, both those sites, all 6 sites from the state should be operating by the end of March, which is what we've been told.
Thank you. And and I'm there again, I know it's a prediction and it's always difficult to put you all in that position, but any prediction when we might start to see the over 65 to 74 range go through the county? Is that a couple weeks away? Is that tomorrow morning? When is that?
Yeah, we started including. Yeah.
So no, I know it started, but I mean to actually get an appointment.
Now they've been getting appointments since last Thursday.
Okay.
So you're saying the last person in that group getting the appointment, is that what you're saying? Through that
not
group?
necessarily the last. I didn't realize because I didn't get I didn't get any a possibility of an appointment. And I'm not asking for myself personally, but I didn't know whether or not you had actually started doing that.
Yes. Yes, we have.
We're about 48% into the 65 to 74 population, which obviously it's about a 90,000 person population.
Yeah.
So say we're about halfway there. So there's still about another 45,000 or so individuals 65 to 74 who need to be vaccinated. And we're getting, 5,000, 4,500 doses a week. So we're not going to be vaccinating, but it's going to be over the next, let's say, 3 or 4 weeks that many of those people are going to get.
Okay. Thank you. And then the only other thing I have is for the executive order, which I guess you're seeing that whether or not you'll send it over today or tomorrow or whatever. Is that your timeline on that?
I believe a draft was sent over at 7:40 a.m. A final version will be sent over tomorrow. And then I believe from conversations with Ms. Michelson that you all would have it to act and take effect presumably on Tuesday.
Very good. Thank you all very, very much for all that you do. Thank you, Mr. President.
Thank you, Councilmember. Councilmember Jawanda.
Thank you, Mr. President. And we will all be very happy to our former president, Mr. Katz, when you are in that other side of that percentage number. I think we'll all be very happy to hear that.
Thank you.
And thank you, as always, Dr. Gales and Dr. Stoddard and Dr. Kroll, to you and your teams, and Dr. Bridges, all that you're doing. I'm happy to hear that there's at least some progress and movement in that the state is going to be looking and assessing the Montgomery College campus up county. That's really promising news. Hopefully we'll get past the assessment and actually get that mass vac site. A couple of questions. How are we doing on the getting teachers vaccinated? What's the latest update? I have 2 children that'll be going back to school on the 15th. I know many people are in that boat. There's a lot of anxiety on both sides of the ledger. Could you just give an update on where we are with the Johns Hopkins partnership and what you know to date about how many teachers have been and educators and staff have been vaccinated?
Well, Councilmember, thank you for the question. I'm happy to report that Johns Hopkins is not the only source of where the teachers are getting vaccinated. And so also as we've moved through to the next priority groups, we've been able to include educators and staff from both public and non-public schools. And Dr. Stoddard has the information, but I believe as of the end of last week, we had sent invitations for opportunities to schedule appointments to approximately 20,000 of the 25,000 teachers and staff from MCPS. And that includes both, I believe, over 12,000 of those, 12 to 15,000 of those were through Johns Hopkins, and another 5,000 to 7,000 were invitations sent out by the county to invite folks in to get covered. I don't have the numbers in terms of who's actually gotten the vaccine, but we have created that opportunity because what we were finding is that a number of people were, while they did get vaccinated through Hopkins, were getting vaccinated in other places as well. We don't have as clear a picture on the non-public school information, but I do believe from Hopkins alone, there were over, I want to say 3,000 folks who had been invited to participate in the clinics. Again, not sure how many of those have actually been vaccinated, but they were at least presented an opportunity to do so. I don't know if Dr. Stoddard has any more information to clarify.
I think it's roughly correct. I would say it's probably, it was 3,000 as of not last Friday, but the Friday before. So my sense of where we're at is probably I've asked for an update from Hopkins. I actually asked for it this morning before we began talking and haven't gotten it yet. We're probably just short of 20,000 MCPS that have been invited through the county or through Hopkins, and probably right around 5,000 of the non-public schools, independent schools who have been invited for appointments. Okay. And probably about half that number have taken appointments or have appointments scheduled.
What's the shelf life on that invitation? I've heard from some. If you missed the email, or if you didn't see it, or it just availability of appointments. So what if you didn't respond the first few days you got the email and
we typically go back through and re-offer appointments to people who did not take it. What we do is we use the list, we send it out to a group, spots fill up. we add more people to the list, we resend and keep rinse repeat until we get to the end. And then what we'll do is we'll use the Immunet data to scrub off the lists and then send a secondary invitation at the end to try and catch anyone who decides between when the first offer comes and when the last offer is available that, you know, if they decide they didn't want to get vaccinated for it, now they do. So we offer them just one more shot. That's what we got.
If you're a teacher who says, I didn't get an email, I want to get vaccinated, what do you do today? Is there somewhere you can go to say, you know, I can't find my email? What do you do if you're in that situation?
So I think that MCPS did do a survey to try and reassess who needed to be vaccinated. That was part of one of the questions that they asked of their educators, and they self-identified, yes, I still need a vaccine. And so I would encourage people, if they haven't filled out that survey, or to talk to through the MCPS administration, because they're the ones who are really aggregating the lists.
Got it.
And really check the individuals who you know, where they may be in that list. And obviously, we're trying to go through based on the reopening schedule. The sooner you might be asked to return to the building and reopening, the sooner your opportunity to vaccinate will come.
Appreciate it. And then last question or comment. I know we've talked about this. I know you from talking to you all offline that you are assessing what the data looks like for younger Black and Latino folks in these target areas at the death rates, you know, based on the letter that this council sent to the governor saying to assess that as part of the people who are most at risk and potentially could be prioritized and opened up in addition to the age fact categories. Is there any update on that, or are you just still continuing to look at the data?
Oh, I'll take on that one. That was me having pulled the initial review of the data together, and I'm still got questions about how the data was pulled together and assembled. So we have some preliminary looks, and that should be done in the next couple of days, Councilmember.
Okay. Thank you very much. Thank you all for everything you're doing. Thank you, Mr. President.
Thank you. Councilmember Rice.
Thank you very much, Mr. President. Excuse me. And thank you, Dr. Gales, Dr. Stoddard, Dr. Kroll, Dr. Bridgers. So I want to start off talking about schools, because we do know that we had the one case that was at Damascus Middle. Just wanted to understand what the procedures were, make sure that those procedures were followed in terms of contact tracing. I do understand that a letter went out to the community, but again, to highlight what Councilmember Albornoz, what Councilmember Navarro was saying, I just want to make sure that that things work the way they should, because we always anticipated and knew that it's inevitable with as many schools and as many students as we have, as many teachers and staff that we have in the schools, it's inevitable that you're going to have cases. We know that. But just want to make sure things worked as though we wanted them to. So if somebody could just comment on that, that would be great. That's my first question.
Sure. Thank you for the question. And you're right. I mean, we pretty much said these cases are going to happen. It's not a matter of if, but a matter of when, and are the necessary precautions put into place. So what happens in a situation, again, depending upon how the case is reported, it sometimes is reported to the school first before, the health department is made aware, and the schools, again, by Maryland law and regulations, are required to notify the health department. The school notifies the health department. The disease control team is able to go through the state system to confirm the case or cases, and then provide preliminary guidance in terms of the steps to do and what to notify. And as they gain more information, then they provide the larger, framework to say if it's a class that needs to be shut down or quarantined, or the school needs to be shut down. So that's the process and how it happens, from the skinniest perspective. But again, want to emphasize to folks is just because there is a case does not mean the whole school gets closed down. It really depends on the incident. Incidents will be different depending upon the level of exposure, who was a particular case, what types of interactions that case had with other individuals, and that information will be the determining factors in terms of what further steps need to happen in terms of being put out to parents or other folks within the facility.
I would only add, I think it's really important to understand, and this is what FCPS is learning, is that the contact tracing process is not an instantaneous knowledge of everything that's happened. It's an investigation. And there's a fact-finding mission associated with where you ask questions, you try and look at data, you try and look at the setup of the classroom and what the person was doing, leading into the building and going out of the building. And so the challenge that's often faced is that, you have the investigation occurring, and MCPS is trying to make some real-time operational decisions at the same time, because it could happen in the middle of the day that this is realized. It could happen at the end of the day before the next day. And so the challenge to the MCPS, and this is sort of why we've been encouraging them to be measured in their reopening, is that there are going to be things that they're going to learn about their processes that you cannot simulate in a conversation. And so it just, gives some sense of the fact that, and for people to understand that a contact tracing investigation, it's not like Dr. Gales knows the instant you call them with a case, oh, this person, this is how many people they were exposed to. That's an investigation. And it will take, it takes hours, and sometimes it can take days depending on the complexity of the investigation and the broadness with which that person may have exposed or been in spaces with others. And so I think it's just important to understand that it will be different timelines in each case depending on the complexity of the investigation, and it may not be as quick as some school officials would like it to be in all cases.
No, thank you very much for that. And I think that, again, it appears from what I've seen that the system did a good job in terms of making sure notification was there, that the public was aware. These are things that we don't want to hide, and it continues to highlight the fact that COVID is still among us. And so to your message earlier, Dr. Gales, about continuing to be vigilant, we heard it from Dr. Fauci. We need to continue to be vigilant, because even though we have the vaccine that's being disseminated, we still have cases that continue to happen. And so folks need to continue to take every precaution necessary. I do want to talk about something that is incredibly troubling. You already heard it from a couple of my colleagues, but it's one of the things that I said from the very beginning was likely to happen, and is the impetus for us asking for an equity plan from the state. There was a great press conference by the governor highlighting that there's going to be an equity plan when it comes to dissemination. And lo and behold, in the midst of this supposed equity plan that's coming from the state, you have pharmacies that are discriminating against people of color. I mean, let's just call it what it is. That's exactly what it was. And so from that perspective, have we heard the status of when this equity plan is supposed to be in place? What pressure the state has when it comes to ensuring that all of the distributors will actually adhere to this equity plan? Has there been any conversations about some of the particulars around this? Because every single day that we allow for, first, the giant transferring from one to another, and now folks being turned away, these stories are going to continue unless we have some set parameters in place. So do we know a timeline of when that's supposed to be happening?
No, there's not, at least on the calls I've been with MDH, there's not been any further timeline. Again, we continue to ask from the health officer's perspective. I will say this, the governor does have a press conference scheduled for 3:30 this afternoon. Perhaps he will comment further on that. But I don't know, unfortunately, beyond that.
I would say that we have taken a look also at the equity plan that they have developed as part of this process. There's no real set timeline that I've been able to find at this point for implementation around this, and I don't know that they have thought through the process of putting together a monitoring and oversight strategy for all of the various distribution points that they've set up. So it is something I think in support of what Councilmember Albornoz was saying earlier, that we need to encourage the state to develop a plan for doing that and for making sure that the kind of discrimination that we heard about yesterday doesn't take place.
Yeah, so yet again, it sounds like yet another empty promise from the Hogan administration when it comes to ensuring the equitable distribution of vaccine to our residents throughout the state, not just here in Montgomery County. All right, thank you.
Thank you. Councilmember Raymer.
Thank you very much. Well, there's so much that we've discussed today. I think just to continue on this question of a state mass vac site, or alternatively increasing our dose allocation in recognition that we don't have a state mass vac site, I think our residents are finding it to be almost an effort to humiliate the county. It makes no sense. Why don't we have the state making a full effort here in Montgomery County? And to both deny us a mass vac site and not to increase our dose allocation is outrageous. And they are seeking to deny this county's residents access to the appropriate share of doses. The fact, as Dr. Gale said, that the state's dose allocation is going up considerably, but our county allocation is not going up considerably, is very problematic, and it implies that the increase of doses are going only to the mass vac sites or perhaps to other counties, which leaves our residents scrambling to drive long distances and figure out how to get there if they don't drive. So I think our posture should be, we'll build a mass vac site, fine. Really what we need is the doses. We've got to get the doses. And, you know, in a sense, the mass vac site is a little bit of an illusion. It's a symbol of the state's effort in the county. But the point is, we can get the doses out. And we just need the doses. So we have to do, I think, more to assert this per capita dose allocation. And, you know, I think the state is responding back, well, hey, your residents are, you know, they're getting more than your population share at the mass vac sites. But that is not fair. And minimally, it requires them to take an undue effort to do that. And it creates a tremendous sense of uncertainty and anxiety in the county, knowing that the state isn't doing its a full effort here. But more problematically, it means that there is a disparity in who can get access to those sites. And it's perpetuating the disparities rather than resolving them. So we need the doses. I wanted to say on the CVS issue, I appreciate Councilmember Albornoz and Hucker for bringing that up. I also had been in touch with the vaccine hunters about this, and the response from CVS that they are required to ask, but a person is not required to provide identification. The only way that can be administered without discrimination is if there is a very prominent sign at every single register, at every single counter, that says we are required to ask, but you are not required to provide. Because otherwise it will just be interpreted as an attempt to bully people and dissuade them from getting access. So I don't know if that must come down from the state level, if the county has the power to require that kind of signage, but I think it really does need to be physical signage at the counters saying we may be required to ask, but you are not required to provide that kind of documentation. Last thing I want to say, I do think we need to look at this question of 6 feet distance required in the schools. I presume that is what the CDC's current requirement is. I know that there has been talk from others that that's something that could potentially shift. I really have no expertise here whatsoever, but that is what is driving everything, of course, as far as the number of students who can be in the buildings and so on. And I am starting to get a little worried about next fall. If we don't actually have that question addressed, 6 feet versus 3 feet and so on, we would be in a situation next fall where we're still in virtual, week on, week off, that kind of thing. So this is a very fundamental question, that we have to, I think, start diving into. But in any event, I'll just say maybe Dr. Gales, is there anything you think we should be tracking or any additional points that we could be making to help the state see that, we can get more doses? When I have communicated with the state, they said, and I don't believe this, but they say, well, if county departments can get out more, we'll give them more. And, in the back of my mind, I worry that when we always get our doses out, kind of like Monday is our last clinic. But I know we've asked for more and they don't give us all that we ask for. So that doesn't seem to ring true. But, is there anything else that we could do to take them up on their word here? Anyway, anything else you want to say, Dr. Gales?
Well, there's 2 points. Thank you for your comments. I think the first point I would make would be your last statement related to health department doses. If you think back to the slide, and unfortunately I can't pull it up, you think back to the slide that shows the percentage of doses administered by the health departments across the board, you're seeing some above 100, some, and most of them are in the high 90s. And in some cases over 100 again. I don't know how they're calculating that for that to be possible. But that's not the issue. We are putting out the doses, and that's not just us here in Montgomery County. You look across, all of my colleagues across the state are doing fantastic jobs getting out the doses that they're receiving. And we're all asking for more to be able to get it to, a higher number of folks within our communities, respecting that we do have relationships with our community partners that are longstanding and help address a lot of the concerns around trusted sources within communities and being able to go out and get that messaging in a personal, intimate way that, larger entities can't because they don't have those relationships. And we also have a higher level of accountability. So, for example, if something like what you all described happening at the pharmacy happened at the health department, you all would be holding us accountable. We would hold ourselves accountable. And, the CE's office would be, demanding and expecting answers from that. Now, to the other piece related to how we move forward, I think when we are in the fall, that will be a different time, given again, hopefully that we will see a higher percentage of our population vaccinated. And we will have a better understanding that time of how variant strains are spread and covered. And so I do think that looking at school in the fall will, at least in my opinion, if we continue to have a successful rollout of the vaccine, will be closer to where we were pre-COVID than where we are right now.
Okay, good. That's assuring. Thank you.
I would also add on the front of getting back, if we were to get vaccines out earlier, I think part of this is also in part of our equity framework is having equity of opportunity, meaning if we, for example, said we're only going to get all of our vaccine out, we're going to get it on Monday and have it all out by Wednesday, hypothetically speaking, by just having these mass sites, we've missed the opportunity for people who aren't available to come on a Tuesday or Wednesday. And so that's why we're doing some of these weekends at houses of worship and things like that. And so as we've shown, and as you noted, we continue to get the vaccine out on a weekly basis. If the state were inclined to, they could say, we're going to give you an extra 500 doses next week. And if you get that out, we'll talk and give you more. But, that might be the method to say, it's not a question of, demonstrate by giving everything out on Tuesday that you can get it all out, but more that, we're trying to give equity of opportunity, not just, get it out all in the first day. And so if the state were inclined to give us an extra couple hundred doses and say, hey, did you get it out? Just like they did. They gave us, I think 300 more Moderna and 1,600 more Johnson & Johnson. And guess what? All those were given out. So clearly we've demonstrated that we're capable of doing more than we're doing functionally. And so I think that should be evidence enough to them that 4,500 doses a week is well below our threshold of capability.
Thanks.
Thank you. Councilmember Glass.
Thank you, Mr. President. Thank you, doctors, for again another update 1 year later. And I appreciate all the comments and questions that my colleagues have asked. And this online, many of us have seen the Baltimore Sun article that basically speaks to what we've all been talking about for a very long time, saying that Maryland's biggest counties have received a smaller per capita share of the COVID vaccines, right? And we've been talking about that this morning. And I just want to give a plug to the media and the important function that they're playing, holding, fact-checking the governor and holding us all accountable for what we're doing and saying, and in some instances what people are not doing yet saying they are. And again, the article goes on to say that Baltimore and Howard County and Montgomery County, we know state, 3 of the counties with the largest population, 3 of the 6, just aren't receiving the same vaccines per capita. And my question for you all is this: last week, Dr. Gales in particular, you spoke truth to power, and we all backed you up in that. And I'm just quite frankly curious: is the governor or anybody else in Annapolis listening to us?
think you'd have to ask them. I don't know.
Well, from your perspective, again, we keep asking and we keep saying how much the need is here. And unfortunately, I feel like, we are a broken record, that every week after week after week, we keep talking about the inequities that exist. We keep talking about the need for mass vaccine sites. We keep speaking truth to power. The media are backing up our claims. And here we are again. And so I respect the position that you are in and understand that you might not be able to ask the question that I asked. But hopefully somebody can. And hopefully folks in Annapolis are listening. And again, towards that end, I want to extend my appreciation for Congress members, Raskin and Trone for sending a letter last week, adding to the choir the need for a mass vaccine site that we've been talking about. But I'm just quite curious, how much longer can we go on like this, stating our needs, asking for help here, and providing all the facts that back it up?
Well, what I would say is this, in terms of from an advocacy perspective, because at the end of the day, we answer to the 1.1 million residents of Montgomery County. You've laid out very clearly all of the efforts from local, regional, state, and federal folks who represent Montgomery County in elected and non-elected positions in terms of advocating for increased resources for our residents. So to the folks watching at home, I want you to understand that we feel your frustration. We are equally, if not more frustrated, and we are continuing to advocate on a daily basis to put that forward. And I will say from the health officer's perspective, we are doing everything we can to make sure that our voices are heard, whether it's about vaccine distribution and reflecting that back to MDH, or to reopening criteria. We collectively came together to write an op-ed that was published in the Baltimore Sun at the end of the week to talk about the dangers and risks of reopening. So we are trying to be as loud as we can, if you will, respecting the circumstances, but we are working to advocate for our residents. And I don't know if the governor is listening, who's providing the advice related to health. We're not included in those discussions. And quite frankly, as I've said before, we unfortunately don't find out what's happening until the general public finds out. In case in point, we have a press conference this afternoon with the governor, and I don't know what it's about. I know that we've been asked to have a separate briefing later on tonight, which recommends that there's probably going to be some recommendations or changes. But I want folks at home to understand is that we are not invited into the room. And so we're trying to use the tools that we have to advocate for you all and to put information out there. But again, it's not clear who is in the room, and it's not clear what advice is being listened to.
Councilmember Glass, I would add one thing to Dr. Gales' comment, and that is that we've seen this process for a year, and we know how it has unfolded. And the thing that has been most supportive from our perspective, from where I sit as Director of Health and where Dr. Gales sits as our Public Health Officer, is the voices you all have raised kind of continuously and increasingly with increasing volume and insistence that there be some changes in how the state is operated. And while I do think they have not necessarily moved to include Dr. Gales and public health officers in that process, I would say they are listening and they are hearing. So the challenge is to keep that voice going and to continue to sound those voices out. It's not a futile exercise, I think. They did not have an equity plan when they started this process. Whether we think it is a great equity plan or not, they have one. This issue we're raising about the pharmacies is one that gets raised. I think whether they respond to it directly or by action is another issue. The mass vaccination site is yet another thing where I think they are, whether or not they acknowledge it formally, the combination of council and delegates and the county executive and the voice of the public is being registered somewhere in that system. And so the goal is to keep registering it, I think, and to keep that process going forward. You all know this. You're elected officials and politicians. You know this better than I do. But I do want to say that this is a moment to continue that pressure and continue that process of conversation with them.
I would wholeheartedly agree with what Dr. Kroll said there. Being involved certainly in the mass vaccination site conversation, I am seeing movement. We haven't gotten an affirm yes, but we're seeing movement in the right direction. I think in part because the voices of all the people you talk to, our congressional delegation, the council, the executive, I feel like all of those advocacy points are making a difference and moving it in the right direction. It's just, I think that, I mean, there's a whole lot of critique and criticism coming to the governor, rightfully so right now. And so I feel like, in some cases they feel like, just add to the pile. But I do functionally see on the ground there being a difference in the tone and tenor of the conversations.
And I would add just one last thought that Dr. Gills, share his frustration about how they've dealt with this. But I do know that the collective voice of he and his fellow public health officers is also registering on the scale somewhere in that decision making process. It'd be nice if they would publicly acknowledge it and embrace them and pull them into that conversation up front. But there is some it is registering.
Well, I started this clearly voicing my frustration 1 year later, and I appreciate the three of you sharing your perspective, which has made me feel better, right? Reflecting upon the conversations that we as a council collectively have been speaking about in this venue and offline as well. And some of those thoughts have been turned into action, and we've nudged and pushed and shoved public policy at the state level to better respond to the needs in our community. There's still more to do, and I'm hopeful that 1 year in, the governor and his team will begin to work in a more collaborative fashion with us, because that is what our community is demanding. So thank you all for all the work that you've been doing this last year.
Thank you. Councilmember Friedson.
Thank you. I won't repeat all the other questions, but echo a lot of the comments and questions of colleagues. In particular, really pleased to hear about the progress with educators, 20 of 25,000. That's really great news. I know everybody's been working really hard on that. We've been talking about it a lot over the past several weeks in these sessions, and so just wanted to express appreciation for you all here, but most importantly to everybody who's working on it on the front lines with you and your team. So thanks for that, and positive to hear some progress on the mass vaccination site, hopefully sooner rather than later, because we all know that it's certainly needed. I'm crossing my fingers with you, Dr. Gales. Just a couple quick questions. The homebound pilot, that's exciting that that's finally off the ground. I know it was a long time coming. A lot had to be worked through. The ready responders and the particular outreach to those with language barriers, I think, is really positive. Do we have a sense of scale, how quickly, it's relatively small right now, but, how quickly it could be ramped up and what that might look like in terms of time period and amount of doses on a weekly basis, give or take?
And thank you for your question, Councilmember Friedson. Again, it's dependent upon the doses that we get. We did 100. We've done 100 in the first pilot. We anticipate, maybe being able to do 100 each week. I think if I remember the pre-registration statistics, we had 700 individuals who had or the pre-registration information who qualified, but who listed mobility as an issue. So we're going to continue to work through that list and hopefully be able to potentially, for example, use some of our Johnson & Johnson doses to be able to supplement and maybe increase the number to provide coverage within that.
Appreciate that. That was going to be my follow-up question about Johnson & Johnson. It seems like that would be a good use. So I appreciate the fact that you're already looking into it. Not surprised, but appreciate it. With that, the Johnson & Johnson currently, we received 1,600 doses. It's our understanding that we're not going to receive another amount of Johnson & Johnson, the state or the county, for several weeks, maybe until the end of the month. Is that still accurate? And do we have an idea of the scale of the next round of Johnson & Johnson? Do we think it'll be similar, larger to this, or we just don't know yet?
So to your first question, yes, that is accurate. It's going to be at least 2 more weeks before we potentially get more doses. And unfortunately, we don't know what the scope of that will be since it's contingent upon their production over the next couple of weeks.
And so currently we're using those, we've used some for educators and for shelters, and now you're looking at potentially homebound as well. Is that where the focus of those doses are currently?
So we had 2 large clinics that were open to a host of different folks. We made those opportunities available to members of the general public by virtue of age, and then essential employees across employees, teachers, childcare, transportation, and we just happened with those that we have left over. We had previous conversations with our colleagues in services to end and prevent homelessness about potentially being able to provide some vaccines for the residents within some of their facilities.
Appreciate that. And then just speaking of the amount of doses, and obviously that's the biggest hurdle that the health department is facing. There's just not enough in order to meet the needs. The 4,500 for the next 3 to 4 weeks, aside from the Johnson & Johnson coming in a few weeks, the 4,500, is that expected to be a minimum amount for the next 3 to 4 weeks? Is that expected to be the number that we've got? Because it was the minimum, and it's also give or take the amount. I know there was about 300 supplemental doses, but give or take that 4,500 has been steady in terms of what the health department is receiving. Is there any indication that that's going to increase based on added supply? I mean, we're hearing lots of positive news at the federal level for potential exponential increases over the next, several weeks and couple months. Is there an indication that the health department is going to, receive a lot more than the 4,500 at this point?
Not at this time. Looking at the report from last week, I think the expectation is that this will be our allocation weekly for the foreseeable future until, there may be some significant changes in the doses that the state receives.
Got it. Okay. And then I think everybody is relieved that we're, opening up based on the numbers of 75 plus that have been vaccinated to tier 2 and 3, and then into 1C, which is the 65 to 74 category. How is the prioritization happening between those tiers? I know that the health department is sending out appointments, but just in the interest of residents understanding, and frankly, me understanding, how that's working, how are those appointments being chosen among those groups, the different tiers, and phase 1C, tier 1, and is however it's working now, is that intended to continue at least for the foreseeable future?
So I'll start that, and I think we can weigh in on that. So within the age frames of the tiers, we are continuing to use our racial equity framework around that. So we're using hotspot zip codes and using the equity framework to draw people from the list, including focusing on folks who are in the 75 and older category that we may have missed or may not have gotten a chance to get registered. So we're looking each week and each time we do a scheduling to pull from that list to make sure we're getting our older residents that can come to a mass vaccination site, or come to our large scale vaccination sites. And then at the same time, we've allocated percentage of the doses to do tiers 1B, T2, and T3. So the programs, the school, the educators, and the folks in shelter, and the folks who are all in that category, to prioritize folks where we are gathering lists of names and people who are eligible, and setting some criteria within each one of those groups. If there is some combination of large group and small group, I think is our pull plan. I think I'm not mistaken, from either Dr. Stott or Dr. Gales, I think, to pull from some small groups so that we can see some forward progress in some of the smaller groups of folks that we have, and at the same time tackle some of the larger groups. For example, we have, I think, in the neighborhood of, at any given time, about 400 people who are in our homeless shelters. So we wouldn't be able to knock them off all at once, knock off the vaccination process for all of them at once, poor choice of words. but we would be able to identify some folks and get some of them vaccinated this week, and at the same time work through our food service workers through that we've identified through the Food Security Task Force. So they're prioritizing the list and giving us information and names, and we're working through those lists as quickly as we can.
So part of the goal is to take a category and try to get through a substantial portion of the category to effectively cross it off the list and move on to another category. So that's part of it. And then obviously the prioritization of hardest zip codes within the age categories, which continues to be a major priority of the health department. Just so I'm understanding it, as a follow-up to that, where does child care workers fit into that category? It's a major issue at the state. I empathize because, you know, there's been a lot of misunderstanding. The state sent out a survey. It felt like a pre-registration for the state agency that regulates it. It wasn't. It was an information gathering survey that has caused a lot of frustration. That is not the health department's fault. You know, I don't want to make it seem that way, but you know, I know the state has placed this burden almost exclusively on the health department to figure out. So just wanted to get a sense of where that fits into the prioritization of groups.
So I'll start there. They're in the current priority for 1B tier 2. Right now, and we've been vaccinating the child care space for several weeks now, along with, we started vaccinating for teachers. We included child care. Dr. Gales got an okay to allocate 100 doses a week of our existing, I believe that's the number, of our existing supply for the purpose of vaccinating child care workers. So we've been asking them to come in, and they're working with our early child care programs to identify and prioritize the list of folks to come in for vaccination. So there is
the number that I read, about 15,000, the expected number of child care workers in Montgomery County. That's a big number with 100 doses, you know, targeted from the state. Obviously, you're doing more than that, but you know, it's a heavy burden with the 4,500 only received each week.
Yeah.
Yeah, it's not a criticism; it's a reflection of reality.
Yeah, and if you got 500 doses, who gets the doses this week, and how do we, you know, divvy them up with all of the demands? It's to Dr. Gill's point, we can't feed everybody at once in this process.
We have increased, my understanding, we have increased from the 100 as we've moved into that tier. We have increased from 100, just to be clear about that.
And it underscores the reality of, because childcare workers, transportation, teachers, food service, grocery store, retail, independent living facilities, and the list can go on. These are all folks who do you tell is higher, who's less of a priority within the doses that we got? And that's the ridiculous challenge in place that we're in, to your point, with the limited doses that we have. So it's not that we don't think anybody is lower priority. It's just, here's what we're trying to do. And the reference Dr. Kroll made was related to the biblical story of, and I'm going to get this wrong, so forgive me to my Sunday school teacher growing up, but 2 fish and 3 loaves.
5 loaves. Is it 3
5
loaves?
loaves. 2 fish, 2. Yeah. So it's that
the multiple young children parents on the council have given you the thumbs up on the reference.
Yeah.
Yeah, no, and I appreciate it. I hope, and I know that educators, MCPS and non-public has been a major priority. There's been significant progress on that. I hope that as that ramps down in terms of, you know, we're at 20,000, you know, when that gets to the 25,000, that a similar, you know, major effort is taken with childcare workers. There are a lot of women of color in particular. There are challenges here, you know, so it requires a major effort, you know, with a lot of different providers. And so, you know, I hope that can be an emphasis. I know you're working on it, and I just wanted to reiterate that call. You're in a challenging situation with a limited number of doses to reach a lot of priorities, but given the importance of childcare for families, for the economy, for our most vulnerable young children, hopefully that will be a major emphasis moving forward, particularly as we hope additional Johnson & Johnson come in a couple weeks and more doses of, you know, based on federal efforts to ramp up. So I'll leave it at that. Thanks for your efforts and appreciate the time answering these questions.
Councilmember Novato.
Thank you, Mr. President. I just really want to, I guess, I don't know if we're wrapping up the conversation, but, a lot of what I have heard in terms of our just constant wondering, why has it been so difficult to send this message to the state that we, really should be getting more doses allocated, as well as, for example, mass vaccination site. Also, this issue with now the pharmacies, et cetera. I think it's so important to keep reminding everyone, again, who we are, right? So, okay, Wallet Hub went ahead and published their 2021 most diverse cities. Of the top 10, we have 4. Gaithersburg is number 2. Our, school system, the 14th largest in the United States, has about 72% children of color. We know that over 42% of our residents speak a language other than English. And we are the largest, of course, jurisdiction in the state. Now, I think this is so significant because, all this conversation we are having and we talk about the equity plan and everything like that, I think we just need to call it for what it is. There is a huge disconnect between this understanding of who we are in this county. And it is quite startling that with, those demographic numbers that I just shared, I mean, the fact that we have, of the top 10, 4 of the most diverse cities in the country, this is just really startling. And this is why on the national level, and actually even from other countries, this whole story about, who we are and this whole issue about, equity and issues about how do we relate to each other and, comments about people's accents and things like that. It's because it resonates because it doesn't make sense. It does not make sense. There's a huge disconnect. And I feel that, here we are twisting ourselves into a pretzel constantly, figuring out how to prioritize and how to do all these things. But it continues to be disheartening that at the state level, that the leadership does not seem to fully grasp who Montgomery County is and how it's placed on a national level vis-a-vis our extraordinary diversity, and how our Black and Latino population, because of the data that we've been tracking from the very beginning, which, by the way, we were way ahead also, because we kept asking for the zip codes early on because we were worried. These are communities who continue to be disproportionately impacted. To me, that's the bottom line. And we all have to continue to share those data points, because sometimes I feel like perhaps folks don't quite get that we're not just, complaining and complaining or asking and asking because we want to, somehow we don't have anything else to do. It's because this is very significant with regards to who we are and how we need to protect not just those 2 communities that I just mentioned, but the rest of the county, because this is a virus. It doesn't ask you for your ethnicity, or it doesn't ask you if you have an accent, it doesn't ask you if you're Black, it doesn't ask you where you came from. If we don't address the issues in these communities, it will affect everybody else. Yes, childcare providers are predominantly women and women of color. Yes, the children are going back to the school system, are going to come back home where you're going to be with predominantly families of color. Every little data point that you slice and slice will get you to that place of understanding who we are talking about. People of color who are disproportionately affected. And oh, by the way, because we're the largest jurisdiction, it affects the region. So I'm not really sure how else we can frame this narrative, but at some point you just got to call it what it is. And it's some very either overt or covert desire to avoid acknowledging who we are, how extraordinary we are, but also how we need to come forward and address in a way that is equitable this issue of vaccination. And I hope that, the conversation that is being had across the country, I hope that this elevates and perhaps resonates with the folks who right now are controlling the distribution of the vaccines. And I can't wait for that moment where production gets to a level when we on the local level then can actually control the distribution, that dissemination, because it has been illustrated, we have an extraordinary team that is ready to go and continues to step up and continues to completely go over what the expectations are. So we're ready. But I think we need to continue to tell our story and talk about, again, our narrative and give voice to the vast majority of the residents of this county who are continuing to be left behind, humiliated when they go to certain pharmacies and are asked, to produce documentation and all kinds of things just because of the way they look or they sound. This is bizarre, but it's what we're facing. So thank you for allowing me to say this, because again, as I keep hearing the questions, there's a theme, there's a thread that is woven throughout this whole conversation. We continue to have to face it and name it every day if it has to be, until hopefully we see some extraordinary results. Thank you so much.
Thank you. Councilmember Jawando.
Amen. I don't have much to say after that. I agree with much which was said. I just wanted to point out, and Dr. Kroll did this maybe 10 minutes ago, we have very specifically, among other things, asked for 5 things: a mass vaccination site for the things that are not happening. These 2 cases about asking for ID and not prioritizing communities that have been hardest hit at your pharmacies and the private sector folks who are receiving the vaccinations. Those were direct asks that we made of the governor. So I hope we get a direct response. I think we're all very concerned about that. But so I appreciate you bringing that up, Dr. Kroll. I'm glad it seems like we're making incremental progress, but it's just not good enough. The one small question I had was related to, I just want to make sure I heard this right, the in-home, the mobile units. Have we had any liaison? I know we have our unit. You said about 100 a week, Dr. Gales. The state was supposed to have some of these as well. Have you heard anything about that?
So yes, that's a great point. We did hear some information about that on a call with MTH, I believe on Friday. They are focusing those mobile units on the Eastern Shore, at least to begin with. And that was, there is no time frame, or at least I may have missed that in terms of when they would launch those, but their first application of those mobile units will be dispatched to the Eastern Shore area to provide additional support and services there. It's still not clear in terms of how those teams we will be able to request those, if you will. I think they're working through those details. And what Councilmember Jawando is referring to is that the state has created they're intending to create these mobile units to roll out and provide vaccination. I don't get the sense that there will be large enough to be able to dispatch to multiple places. But again, I know they're going first to the Eastern Shore area, okay, from my understanding.
Yeah, and that was one of the things. The 2 things that were substantive that I heard out of the equity plan were that they were going to do these mobile units to vaccinate. And okay, thank you for the update. They're going to the Eastern Shore. Hopefully we can figure out how we can use that capacity. And that they were going to be doing these smaller assessing community sites to give extra doses. And I know we've talked about that offline as well. And it's certainly, we want to get our fair share of those to the extent that there are additional opportunities for additional doses and targeting in communities. Again, the large systemic things is that prioritize equity in where you're giving the most doses and give us more doses. Those 2 things have not happened, correct, Dr. Gales?
Correct. And so we, excited to hear about, assessing different community venues and so forth. And, the pop-up tests that are coming up, I know the state part of that has been they've been working and contacting religious institutions to set up clinics there. The larger question is, though, is that once that one-time opportunity is done, what is the level of investment into the local infrastructure to be able to stand up and sustain those efforts? So, for example, we've been getting calls from places saying, hey, yeah, the state's got this scheduled. And don't get me wrong, we are excited to get as many people vaccinated as possible. So if there's clinics set up, we're happy to support in those efforts. But then the question is, they ask us, they say, well, how can you help us stand this up and move this forward? And our answer is we don't have the capacity to be able to supply you with doses on a weekly basis because, again, we're pulling from this allocation.
Yeah, well, that's an important point. Well, hopefully those will be sustained over time, and I've been certainly making that message clear as well, and I know all of us have. All right, thank you, Mr. President.
Thank you, Council Member. Folks, I don't see any other requests to speak, so let me thank you again for all your hard work. It's been an incredible year. We have a long way to go, but we're all really grateful for all your hard work and your leadership. Thanks so much.
Council President, one more point. We're looking forward to the U.S. House passing the American Rescue Act tomorrow. The county executive looks forward to working with the county council on figuring out how we utilize these critical funds to support our community. So just wanted to get that plug in and appreciation for our congressional delegation.
Yes, absolutely. Well said. Okay, thanks everyone so much. Stay safe.
Stay safe, everyone.
All right, colleagues, I just need a motion to approve the consent calendar.
So moved.
Second.
Councilmember Rice moves, Councilmember Friedson seconds. All those in favor, please raise your hand. Oh, Councilmember Reamer.
A few sentences, if I could.
Please go ahead.
I just wanted to thank the council for consideration on the housing issue we've been working on for many months now. We had a joint committee meeting on it in September, I think, and we have appropriation now to get started on a really exciting program with HOC and their private partners. That is the first installment is really just for the remainder of this year, but the vision here for a $50 million annual fund, or a $50 million fund that will revolve and could create, 8,000 plus units of housing every 10 years or so. Really exciting. Thank you for everyone's work. Thank you to staff. A lot of detailed work by staff. We'll be taking this up in a couple of weeks at full council. Thanks.
Thank you. Councilmember Glass.
Thank you, Mr. President. I just want to take a moment of personal privilege to share my appreciation of Councilmember Nancy Navarro, because last week during our council session, Councilmember Navarro was ridiculed on our Zoom by staff, and it was overheard on a hot mic, making fun of her accent. And I just want to say that I don't think that behavior is acceptable at all. And that is not the type of behavior that we want in our community, that we know we love, that is home to 33% of our population, nearly 40% of our population are immigrants, 4 of the 10 most diverse communities in the country. And I just want to publicly stand with Councilmember Navarro and express my appreciation for everything that she is, everything that she's done for our community, and an example that we need to continue working here in Montgomery County and here at the council to make sure that everybody is welcome. Thank you.
Well said. I think you speak for all of us. Councilmember Navarro.
Councilmember Glass, I very much appreciate your words. I was not planning on saying much, but just very short. We'll only add that this incident has struck a chord around this country and actually outside this country, because people see themselves reflected in a lot of different ways. To me, though, it has offered an opportunity for us to also understand that macro and microaggressions have impacts that are significant for us as public officials, as people who make policy decisions that affect people's lives on a daily basis, who make budgetary decisions that affect people's lives on a daily basis. We need to be aware that the type of climate that we have within our offices also have a impact on the decisions that are made. And we have seen through this pandemic that that can be life and death. And so even though, this may have been to some people a very minor issue, to me, it seemed to strike a chord with people who understand that the additive nature of microaggressions have real, significant, structural consequences, as like the ones that we have discussed among this council, who have led to the kinds of disparities that we're still trying to fight today. And that should not be taken lightly. And I so much appreciate the fact that this is a council and a place where we are not afraid to speak up, to talk about these things, not sweep things under the rug, because that is how we move forward and that is how we progress. So I appreciate you, and I appreciate colleagues who have reached out. I think that we need to do better, and I'm sure that we will. Having said that, and I will also like to express my absolute solidarity and support for our staff of color who help us on a daily basis and who also go through a lot of the same types of instances and who oftentimes elect not to bring up. So I see you and I hear you. Having said that, really excited about this housing fund. We did have this joint session, and it's a really wonderful opportunity, a really wonderful partnership with HOC. I think this will allow us to be very innovative and test these types of approaches as we continue to work towards our housing goals. So really excited for the joint committees to finally see this moving forward. Thank you.
Thank you. Councilmember Friedson.
Well, first of all, ditto to Councilmember Glass and everything that was said, and share all of our support for Councilmember Navarro and for your comments, and just want to lift those words up and lift you up, and appreciate all of your leadership on this council and the grace and grit with which you've handled what has been a very tough week and a very challenging dynamic, and not only starting or continuing, I should say, really a needed conversation in our workplace and at the council, but frankly, a national conversation about these issues that really aren't unique to Montgomery County and aren't unique to one workplace over another. And you have been doing that for a very long time, and really appreciate your willingness to continue to do it. It'd be easy to give up and give in, and you've refused to do that, and a lot of people are benefiting from your willingness to do that. So thank you very much for that. And similarly, I also wanted to note the housing fund, which has been a great partnership of a lot of work. This was about 16 months or so in the making. Councilmember Rima will correct me on the exact month when these conversations started, but it's part of this council's continued effort to really lift up housing as one of the most important issues facing Montgomery County. I think this council has shown tremendous leadership in housing. If we want to make Montgomery County a welcoming place, if we don't want to have a wall that fends off residents, that makes it accessible to new families, new workers, new jobs, new opportunities, we have to provide the housing infrastructure to make that happen. And that can't just happen by buying existing properties. We have to build new affordable housing properties, and affordable housing doesn't just happen. It has to be subsidized. And so I really look forward to continuing with this work. It's a creative approach to exponentially increase the efforts that this council's already put in. And I really just want to appreciate Councilmember Reamer and Councilmember Navarro in particular, the joint committee chairs, for all of their work on this issue and the partnership and being able to navigate through it.
Thank you. Council Vice President Albornoz.
Thank you, Mr. President. So this is not a comment regarding the consent calendar. I made a statement yesterday during our press conference. You did as well on behalf of the council, supporting our good friend and colleague, Councilmember Navarro, but this is personal for me. As I shared in a Facebook post, I've known Councilmember Navarro for the better part of 18 years. She's been a mentor, she's been a friend, she's been a guide to me and many among us. And like her, I have received many text messages and messages from friends, from family that have expressed painful stories that they shared with me, some of which I had never heard before. And this is a moment that has struck a chord, and her leadership 2 years ago as council president, shepherding us through the racial equity framework that now embodies this body and it will outlast all of us. And her comments just 20 minutes ago about pushing the state and our community and all of our elected bodies and policymakers towards definitive equity is just a testament to her leadership. Así que Nancy, eres una gran amiga. Te quiero agradecer por todo lo que has hecho para mí personalmente, profesionalmente, por todo lo que has hecho para nuestra comunidad, por todo lo que vas a seguir haciendo para nuestra comunidad. Gracias por todo. And to all of our staff and our colleagues, the council president and Marlene and I are 1,000% committed to learning from this experience, to moving forward from this experience, to make sure, obviously, that it never happens again, but that we come out of this stronger as we always try to strive and do. So thank you all so much for just continuing to serve together, and thank you, Nancy. We love you. We stand with you. I know all my colleagues feel the same way. Thanks.
All right, well said. Thank you all. We have a motion to approve the consent calendar. All those in favor, please raise your hands. That is unanimous. Okay, we stand in recess until our virtual brown bag lunch with the regional service directors at 12 o'clock. Thank you.
Share is called Kind Soup for the Soul, which is this amazing initiative that our executive director, Deb, came up with. And it's making soup